You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumothorax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. A pneumothorax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness. You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumothorax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. A pneumothorax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness. Eye lubricants are used for all but the following: A. To replace tears or add moisture to eyes. B. To moisten contact lenses or artificial eyes. C. To achieve meiosis during eye surgery. D. To protect the eyes during surgery or diagnostic procedures. The answer is C. To achieve meiosis during eye surgery. Eye lubricants are not used to achieve meiosis during eye surgery. Eye lubricants are frequently used to treat dry eyes in cases where tears need to be replaced, to moisten contact lenses, or to protect eyes during surgery. Which of the following is part of a standard treatment plan for a diagnosis of stage I Lyme disease? A. Administration of intravenous antibiotics. B. No treatment unless the disease progresses to stage 2 or stage 3. C. Administration of oral antibiotics. D. A topical antihistamine to reduce symptoms. The answer is D. A topical antihistamine to reduce symptoms. Stage 1 is called early localized Lyme disease. The infection is not yet widespread throughout the body. This is treated with a topical antihistamine to reduce symptoms. Which of the following is considered to be a normal age-related ocular degeneration? A. Glaucoma. B. Blepharitis. C. Presbyopia. D. Cataracts. The answer is C. Presbyopia. Presbyopia, or farsightedness, is caused by a loss of elasticity in the lens of the eye, and is considered a normal change with aging. Glaucoma, blepharitis, and cataracts all carry increased risk with advanced age, but are considered to be abnormal and/or pathological changes. Which of the following is not a risk factor for infertility in men? A. Moderate cigarette smoking. B. Frequent spy use. C. Untreated chlamydia. D. Major hernia surgery. E. Mild sun exposure. The answer is E. Mild sun exposure. Cigarette smoking and other poor lifestyle choices have been shown to cause decreased fertility in men. Surgeries such as hernia repair could also have a negative effect on male fertility. Sexually transmitted infection can cause fertility problems, especially if left untreated, in males and females. Frequent hot tub or spa use has also not recommended. Mild levels of sun exposure are the least likely of the above to cause infertility in men. The nurse is educating a 19-year-old female on contraceptive methods. The nurse describes which of these as the most effective? A. The male condom. B. Fertility awareness. C. Withdrawal before ejaculation. D. The female condom. E. A diaphragm and spermicide. The answer is A. The male condom. The male condom is the most effective when used correctly. However, if used incorrectly, carries a much higher risk of failure. The male condom is also the only method of the answer choices that also carries protection against sexually transmitted diseases. The nurse is educating a 23-year-old woman on contraceptive options. She describes which of these as the most effective? A. Medroxyprogesterone acetate injection. B. The cervical cap with spermicide. C. Oral contraceptives. D. Etonogestrel/ethinylestradiol ring. E. Contraceptive patches. The answer is A. Medroxyprogesterone acetate injection. Medroxyprogesterone acetate injection is the most effective of the listed methods. Other methods of the above carry the risk for displacement or incorrect use. The nurse should inform the client that the medroxyprogesterone acetate injection is not effective against sexually transmitted diseases. The nurse is educating families in northern Wisconsin on the subject of tick removal. The nurse knows that teaching has been effective when they state all but which of the following? A. Grab the tick as close to the skin as possible. B. A fine-ended tweezer works best. C. After grasping the tick with the tweezers, twist until removed. D. Use gloves to protect fingers when removing ticks. E. Save the tick in your freezer. The answer is C. After grasping the tick with the tweezers, twist until removed. Never twist, jerk, or rip the tick when attempting to remove them from the skin. Wear gloves or use a paper towel if they are not available. Seal the tick within a plastic bag and keep it in the freezer. If illness occurs, the tick may be useful for further testing. Which of the following is a bacterium frequently responsible for causing urinary tract infections? A. Clostridium botulinum. B. Escherichia coli. C. Candida albicans. D. Mycobacterium leprae. E. Treponema pallidum. The answer is B. Escherichia coli. Escherichia coli is a bacteria that lives in the normal flora of the intestines. However, it is also a frequent cause of urinary tract infections. Candida albicans is a fungus that frequently causes thrush and vaginitis. Mycobacterium leprae is responsible for leprosy or Hansen's disease. Treponema pallidum is a spirochete responsible for syphilis. Lastly, Clostridium botulinum is responsible for botulism as a result of its secretion of a neurotoxin. Which of the following bodily fluids does not transmit human immunodeficiency virus, HIV? A. Breast milk. B. Blood. C. Vaginal secretions. D. Semen. E. Saliva. The answer is E. Saliva. HIV is easily spread through all of the listed body fluids with the exception of saliva. A person may not contract HIV through exchange of saliva during activities such as kissing or sharing eating utensils. Which of the following regarding human immunodeficiency virus, HIV, is false? A. The risk of transmission increases in individuals who have another sexually transmitted infection such as genital herpes. B. In heterosexual encounters, it may be easier for a woman to contract HIV. C. The number of disease particles in a fluid is called the viral load. D. HIV can spread to other individuals starting 2 weeks after the host is infected. E. Healthcare workers have a relatively low risk of contracting HIV when using standard precautions. The answer is D. HIV can spread to other individuals starting 2 weeks after the host is infected. HIV may be contagious just days after the host is infected. Women in heterosexual relationships may become infected more easily than men due to prolonged exposure to bodily fluids. It is, however, possible for men to contract HIV from an infected woman. HIV is not frequently transmitted to healthcare professionals. Even for those who suffer from needle stick injuries, transmission is unlikely. Symptoms of acute human immunodeficiency virus, HIV, typically occur within how long after infection? A. 8 to 12 weeks. B. 1 to 2 weeks. C. 4 to 8 weeks. D. Greater than 1 year. E. 2 to 4 weeks. The answer is E. 2 to 4 weeks. Symptoms of acute HIV generally occur 2 to 4 weeks after infection. A vast array of symptoms may be present, such as fever, rash, generalized fatigue, nausea, vomiting, diarrhea, and a sore throat. The nurse prepares to insert a peripheral venous catheter, PVC. Which of the following is an incorrect step in this process? A. Secure catheter with tape. B. Assess for infiltration or hematoma. C. Hold skin taut to stabilize vein. D. Explain procedure to patient and confirm identity. E. Insert catheter bevel down at a 15-degree angle. The answer is E. Insert catheter bevel down at a 15-degree angle. The catheter needle must be inserted bevel up at an angle between 10 to 30 degrees. The correct steps for inserting a peripheral venous catheter, PVC, are: 1. Explain procedure and check identity. 2. Prepare equipment at the bedside on clean surface. 3. Apply appropriate personal protective equipment as needed. 4. Distend veins by applying tourniquet 4 to 6 inches above site. 5. Clean site with facility-approved cleaning solution. 6. Hold skin taut to stabilize vein. 7. Insert catheter bevel up at an angle between 10 and 30 degrees. 8. Pierce skin and vessel to enter vein. 9. Advance catheter until blood return observed, then remove tourniquet. 10. Withdraw needle from catheter and advance catheter to hub. 11. Secure catheter with tape or facility-approved dressing. 12. Attach forward tubing and begin infusion. 13. Assess for complications including infiltration or hematoma. The surgical nurse cares for a patient status post-umbilical herniorrhaphy. Which of the following nursing interventions is a priority for the nurse? A. Avoid coughing. B. Preventing overexertion. C. Relieve urinary retention. D. Provide ice packs. E. Turn and deep breathe. The answer is E. Avoid coughing. All of these are important nursing interventions for a post-op herniorrhaphy patient. The priority is to prevent increasing intra-abdominal pressure. Relieving urinary retention and avoiding coughing are the most important considerations to achieve this priority, but it is most important for the nurse to remember to avoid coughing, as it is most likely to increase intra-abdominal pressure. It is also important to remember because it is often promoted for other post-operative procedures, and this is one case where it is not. The community health nurse educates a group of young boys who are learning about hiking safety. Which of the following statements made by the nurse is not effective for preventing Lyme disease? A. You should be aware of where ticks infected with Lyme disease are located, particularly in the upper Midwest, New England, and the Mid-Atlantic region. B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. C. You should wear insect repellent on your skin and clothes if you are in an area endemic to Lyme disease. D. Try to cover as much of your skin as possible, long pants, long sleeves, long socks, and cover your neck and hands too. E. After you hike in a Lyme disease endemic area, carefully examine your skin for ticks. The answer is B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. Prophylactic antibiotics are not indicated for the prevention of Lyme disease. Antibiotics will be used after a tick bite when symptoms develop and an infection is suspected. The community health nurse should teach rules of prevention, including 1. Knowing where Lyme disease is prevalent, New England, Upper Midwest, Mid-Atlantic states. 2. Wearing long sleeves and long pants, covering as much skin as possible with clothing. 3. Using insect repellents such as sprays over the whole body, and 4. Checking for tick bites especially after exposure is anticipated, so you may receive care as quickly as possible if needed. Which of the following should be restricted in a patient with end-stage renal failure? A. Fluids. B. Protein. C. Potassium. D. All of these are correct. The answer is D. All of these are correct. A patient with end-stage renal failure should be kept on a low-protein, low-potassium diet. Fluid restriction is also an important part of management of patients with end-stage renal failure and patients on dialysis. A 75-year-old female with end-stage renal failure asks her nurse for advice about her diet. Knowing that this patient must adhere to a low-potassium diet, the nurse cautions her against which of the following foods? A. Eggplant. B. Cherries. C. Orange juice. D. Apples. The answer is C. Orange juice. Orange juice is very high in potassium. 1 12 ounces glass of orange juice contains 705 milligrams of potassium. This could easily increase blood potassium to dangerous levels. The other fruits and vegetables listed are all low potassium foods suitable for consumption by individuals needing to follow a low potassium diet. A nurse is looking over a basic metabolic panel for a 69-year-old male. She notices that his bun is 12 milligrams per deciliter. This value is dash. A. Normal. B. Depressed. C. Borderline elevated. D. Elevated. The answer is A. Normal. Bun, or blood urea nitrogen, is a measurement of the kidney's ability to excrete urea, which is a byproduct of protein metabolism. This patient's bun is within normal range. The reference range for bun is 7 to 20 milligrams per deciliter. You are the nurse taking care of an elderly patient with severe dementia and limited mobility who is at a high risk for developing a pressure ulcer. Which of the following options is the best first-line approach to preventing development of a pressure ulcer in this patient? A. Turning the patient multiple times per day. B. Applying topical antibiotic ointment to cover the patient's entire body surface. C. Administering broad-spectrum intravenous antibiotics. D. Request a dermatology consult. E. Administer a one-time dose of broad-spectrum intramuscular antibiotics. The answer is A. Turning the patient multiple times per day. In the preventive stage for pressure ulcer management, there is no need to perform any invasive procedures. Administer antibiotics in a patient who may be at high risk for needing broad-spectrum antibiotics in the future, hence fostering antibiotic resistance, or consult subspecialty services, as there is no dermatological condition to be treated at the moment. The best option to prevent a pressure ulcer in a patient who is at high risk for developing a pressure ulcer is to turn the patient regularly while they are in bed, if they are bedbound. By turning the patient, the high-pressure areas that would be at the highest risk for development of a pressure ulcer are able to have relief from pressure for a greater proportion of the day, night, and as such, can have blood flow restored while the patient is turned. By allowing for maximal blood flow to these regions, the risk of ischemia and subsequent infection and/or ulcer development is decreased. Without the actual development of an ulcer or infection, administering antibiotics, either topically, intramuscularly, or intravenously is inappropriate. The nurse taking care of a 15-year-old male wrestler at a primary care clinic who complains of a raised, red, ring-like rash with central clearing on his lower back that he states is very itchy. Which of the following is the most likely diagnosis? A. Tinea corporis. B. Tinea cruris. C. Tinea capitis. D. Tinea menuum. E. Tinea pedis. The answer is A. Tinea corporis. Tinea corporis is also known colloquially as ringworm. The described case is a classic case for tinea corporis, in which the patient is a young athlete, often a wrestler, due to the frequent skin-to-skin or skin-to-mat contact in damp, sweaty environments, who presents with an itchy, red, ring-like rash that exhibits central clearing. The word corporis qualifies that the fungal dermatophyte infection, tinea, is specifically located on the body/torso/back region. The other choices are incorrect, as tinea capitis is a fungal infection of the scalp, tinea pedis is a fungal infection of the feet, tinea cruris is a fungal infection of the groin, jock itch, and tinea menuum is a fungal infection of the hands. You are a nurse in an emergency department and a patient presents with a 5 cm by 6 cm abscess on the dorsal aspect of his left hand. The hand is very painful, but he has full range of motion, and no sensory deficits. He is febrile and has no systemic or localized symptoms aside from the abscess. Which of the following is the most appropriate next step in management? A. Prescribe oral antibiotics without draining the abscess. B. Inject steroid into the abscess. C. Amputate the affected hand at the wrist. D. Apply topical antibiotic to the abscess. E. Incision and drainage of the abscess. The answer is E. Incision and drainage of the abscess. An abscess, by definition, is a walled-off collection of pus and bacteria, that is typically impenetrable to topical or systemic antibiotics. The only way to truly resolve an abscess is to incise and drain it, such that the walled-off material can be expelled, and the pressure and pain can be relieved. Further, the material should be sent for culture so that the patient can be placed on appropriate antibiotics if the physician deems it necessary for post-drainage care. The other choices are incorrect. Surgical amputation of the affected hand would be a drastic measure for a localized abscess that is not otherwise causing limb ischemia or necrosis. Incision and drainage is a much more reasonable first step. Injecting a steroid into the abscess would be a potentially dangerous intervention, as steroids decrease the body's immune response to infection, and as such, could increase the bacterial load within the abscess, allowing it to expand and become more serious. As mentioned earlier, topical and oral antibiotics would likely be impenetrable to the abscess and would be inappropriate first steps when the option of incision and drainage exists. Which of the following causes microcytic hypochromic anemia? A. Chronic lead exposure. B. Iron deficiency. C. Thalassemia. D. All of these. The answer is D. All of these. All of these result in microcytic hypochromic anemia, which is a type of anemia characterized by small red blood cells called microcytes that contain lower concentrations of hemoglobin than healthy red blood cells. What is the most significant risk of hyperkalemia? Elevated serum potassium. A. Rhabdomyolysis. B. Sudden cardiac death. C. Respiratory depression. D. Weakness, tremors, and cramps. The answer is B. Sudden cardiac death. Mild hyperkalemia may be asymptomatic, but a significant rise if potassium levels above normal can cause fatal heart arrhythmia, resulting in sudden cardiac death. Weakness, tremors, and cramps are common symptoms of mild hypokalemia, depressed potassium levels, while respiratory depression and rhabdomyolysis can occur with severe cases of hypokalemia. Cranial nerves are important to assess to determine the neurological status of a patient in regards to possible deficits. All the following cranial nerves should be assessed for proper eye movement and function, including vision except dash. A. Cranial nerve 6. B. Cranial nerve 8. C. Cranial nerve 3. D. Cranial nerve 2. E. Cranial nerve 4. The answer is B. Cranial nerve 8. Cranial nerve 8 is the vestibulocochlear nerve responsible for hearing and balance. It does not control the eye. Cranial nerve 2 is the optic nerve, control vision and acuity. Cranial nerve 3 is the oculomotor nerve, which controls eye movement, pupil reflex, eyelid, and proprioception. Cranial nerve 4 is the trochlear nerve, which controls extraocular eye movement, as does cranial nerve 6, the abducens. What is the most common cranial mononeuropathy in diabetic patients? A. Cranial mononeuropathy 6. B. Bell's palsy. C. Auditory neuropathy. D. Third nerve palsy. The answer is D. Third nerve palsy. Third nerve palsy, cranial nerve 3, the oculomotor nerve, is the most common cranial mononeuropathy seen in diabetic patients. They will present with ptosis, dilated and fixed pupils, and an outward and slightly downward deviation of the eye. Bell's palsy involves unilateral facial paralysis as a result of damage to the facial nerve, cranial nerve 7. Cranial mononeuropathy 6 is caused by damage to the abducens nerve, cranial nerve 6. Signs of damage include inability to laterally rotate the eye and/or double vision. Auditory neuropathy may be a result of damage to the vestibulocochlear nerve, cranial nerve 8. The most pronounced symptom is loss of audition. What condition is described by the following? A defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. A. Wilson's disease. B. Huntington disease. C. Ceruloplasminemia. D. Hereditary hemochromatosis. The answer is A. Wilson's disease. Wilson's disease is characterized by a defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. This results in copper accumulation, primarily in the liver and the brain. Signs and symptoms include liver failure, cognitive deterioration, clumsiness, and changes in behavior. Symptoms often start in adolescence, but can start any time between 6 to 20 years old. Ceruloplasminemia is a rare condition of iron accumulation in the basal ganglia, retina, and liver. Hereditary hemochromatosis is also a disorder of iron accumulation, often caused by mutations in the HFE gene. Huntington disease is a genetic neurodegenerative disease unrelated to any mineral storage disorders. A 62-year-old male client is admitted to the hospital with acute pancreatitis. The client has a well-established history of alcohol abuse. The nurse caring for this client is aware he may exhibit withdrawal symptoms during the inpatient course. The nurse's plan of care for this client should include assessment for all the following symptoms of alcohol withdrawal except A. Hypersomnolence. B. Tremors. C. Visual hallucinations. D. Hypertension. E. Seizure within the first 24 hours. The answer is A. Hypersomnolence. The symptoms of alcohol withdrawal may include confusion, disorientation, and anxiety. Hypersomnolence or excessive sleep is not associated with this condition. Additional symptoms may include agitation, hypervigilance, tremor, rapid and irregular heartbeat, hypertension, seizure, and hallucinations, mostly visual. Approximately 80% of strokes are of what type? A. Hemorrhagic. B. Transient ischemic attack. C. Ischemic. D. None of these. The answer is C. Ischemic. Approximately 80% of strokes are ischemic, either caused by thrombus or emboli. Hemorrhagic strokes only account for approximately 15% of all strokes, but are significantly more lethal and account for 30% of all stroke deaths. They involve the rupturing of a weakened blood vessel in the brain and subsequent bleeding in the surrounding areas. Transient ischemic attacks are not considered true strokes, and are often referred to as mini strokes. Which artery is most commonly involved in ischemic stroke? A. The middle cerebral artery. B. The anterior cerebral artery. C. The posterior cerebral artery. D. The posterior inferior cerebellar arteries. The answer is A. The middle cerebral artery. The most common artery occluded in ischemic stroke is the middle cerebral artery, which supplies a large percentage of the frontal lobe and the lateral surface of the temporal and parietal lobes. Occlusion of this artery affects the motor and sensory areas of the face, throat, arm, hand and the areas for speech. Which of the following is the most common etiology of intracerebral hemorrhagic stroke? A. Medications. B. Arteriovenous malformation, AVM. C. Trauma. D. Hypertension. The answer is D. Hypertension. Hypertension is a leading etiology in intracerebral hemorrhagic stroke. Chronic hypertension can cause damage and stress to the blood vessel wall, leading to aneurysm or increased risk of spontaneous rupture. AVM, trauma, and medications such as blood thinners are all also responsible for a significant, though lesser, number of hemorrhagic strokes, or may be comorbidities that increase the risk of a rupture in the presence of prolonged hypertension. What is the most common cause of meningitis? A. Viral infection. B. Aseptic inflammation. C. Bacterial infection. D. Fungal infection. The answer is A. Viral infection. All of the answers given are possible causes of meningitis, but the most common, and least severe, etiology is viral. There is no vaccine for viral meningitis, but there are vaccines for 3 different organisms that cause bacterial meningitis. Neisseria meningitidis, meningococcus. Streptococcus pneumoniae, pneumococcus. Haemophilus influenzae type B, Hib. A client has a history of spinal injury and the nurse is evaluating the client with the onset of new symptoms. The symptoms include hypertension, a throbbing headache, a slow heart rate of 40 beats per minute, and piloerection. The nurse recognizes these symptoms are consistent with what disorder? A. Brown-Séquard syndrome. B. Spinal shock. C. Neurogenic shock. D. Malignant hypertension. E. Autonomic dysreflexia. The answer is E. Autonomic dysreflexia. These symptoms are evidence of autonomic dysreflexia, which is a sequela of spinal shock. It is a medical emergency and requires immediate intervention as it may lead to stroke, cardiac arrest, coma or death if untreated. A 23-year-old male college student presents to the emergency room after experiencing a high fever, nausea, vomiting, and knuckle rigidity. The nurse recognizes that this combination of symptoms are indicative of bacterial meningitis. The nurse is aware cranial nerve dysfunction is related to the condition. Which of the following cranial nerves, CN, is correctly matched to its dysfunction? A. Irritation of CN6 may cause hearing disturbances such as tinnitus. B. Irritation of CN5 may lead to loss of the corneal reflex. C. Irritation of CN3 may cause papilledema as seen with increased intracranial pressure. D. Irritation of CN2 may cause ptosis, a drooping of the ipsilateral eyelid. E. Irritation of CN8 may cause deficits in facial movements. The answer is B. Irritation of CN5 may lead to loss of the corneal reflex. The trigeminal nerve, CN5, is responsible for both sensory and motor functions of the face, including the corneal reflex, which is also mediated by the facial nerve, CN7. CN2, optic nerve, affects vision, including causing papilledema, swelling of the optic disc. CN3, oculomotor dysfunction may cause ptosis. Cranial nerve 8, vestibulocochlear, is responsible for hearing, and cranial nerve 6, abducens, is responsible for horizontal eye movements. A 27-year-old female presents complaining of an inability to smile normally or close her left eye. She states that she woke up and noticed that the left side of her face was not responding when she tried to blink, smile, or speak. She also feels a pain in her left ear. She has never experienced this before. The nurse does a physical exam, which is notable for left-sided upper eyelid retraction, general left-sided facial muscle weakness, and left-sided brow droop. There are no cognitive or sensory defects noted. What is the most likely cause? A. Otitis interna. B. Myasthenia gravis. C. Bell's palsy. D. Transient ischemic attack. The answer is C. Bell's palsy. The symptoms and physical exam of this patient are consistent with the diagnosis of Bell's palsy, a rapid onset cranial nerve disorder that results in unilateral facial paralysis or weakness. Symptoms usually come on within 24-72 hours and may include facial tingling, ear pain, taste disturbance, headache, issues with balance, cognitive changes, and clumsiness. A young woman presents to a clinic complaining of unilateral headaches that she describes as throbbing, like a hammer was hitting my head. She experiences these headaches 5 to 10 times per month, and an episode can last up to 24 hours. During the headache she is sensitive to light, sound, and smell. On a few occasions the pain has been severe enough to induce vomiting. She feels better with coffee, and by lying down alone in a dark room. Her headache is most likely which of the following types? A. Sinus. B. Tension. C. Migraine. D. Caffeine withdrawal. The answer is C. Migraine. The symptoms this individual describes are most likely due to migraine headache, migraine without aura, also known as common migraine. Migraines are diagnosed by the following criteria: more than 5 episodes, lifetime. Headache lasts 4 to 72 hours. During headache at least one of the following: nausea, vomiting, photophobia or phonophobia. Headache has at least 2 of the following characteristics: unilateral, moderate or severe pain intensity, pulsating. Aggravation by normal physical activity, may cause avoidance of normal activities of life. Not attributed to another disorder. A 37-year-old man comes into the clinic for chronic headaches. He describes his headaches as in his forehead and temples bilaterally, occasionally wrapping around his head toward his neck. Pain is rated as a 4 out of 10. He has these headaches around 3 times per week. No photophobia with his headaches, no nausea or vomiting. Headache feels better when he presses on his scalp. When asked to describe the sensation of the headache, he replies that it's like a band around his head. These headaches are not preventing him from normal activity. These are most likely what type of headache? A. Cluster headaches. B. Ocular migraine. C. Classic migraine. D. Tension headaches. The answer is D. Tension headaches. The symptoms described by this individual make tension headaches the most likely diagnosis. Tension headaches are defined by the following criteria: minimum of 10 episodes occurring on less than 15 days per month for at least 3 months. Headaches last from 30 minutes to 7 days. Headache has at least 2 of the following qualities: mild or moderate intensity, bilateral, pressing or tightening, non-pulsing, quality, not aggravated by routine activities of daily living. Both of the following: no nausea or vomiting. Either photophobia or phonophobia, but not both. A 21-year-old male presents to clinic for extremely painful headaches. Pain is felt above the left eye and described as a 9 out of 10. Headaches are short, most episodes last for 30-45 minutes, and always on the left side. He notices that during an episode, his left eye will become red and watery, and his nose will run on the left side. He has up to 3 episodes per day. During a headache he will become agitated and restless, and will pace, groan, and hit the wall or floor with his fist. He is very concerned that he may have a brain tumor, meningitis, or some other serious condition. His headaches are most likely which of the following types? A. Tension headache. B. Migraine without aura. C. Migraine with aura. D. Cluster headache. The answer is D. Cluster headache. The presentation of this patient's headaches would make cluster headache the most likely diagnosis. Cluster headaches are defined by the following criteria: at least 5 attacks, severe unilateral orbital, supraorbital or temporal pain lasting 15 to 180 minutes. Headache is accompanied by at least one of the following: ipsilateral conjunctival injection and or lacrimation, ipsilateral nasal congestion and or rhinorrhea, ipsilateral eyelid swelling, ipsilateral facial sweating, ipsilateral miosis or ptosis, restlessness or agitation. Attack frequency ranges from every other day to 8 per day. Not attributed to another disorder. Which of the following is not a common trigger for migraine headaches? A. Caffeine. B. Medication. C. Food allergies. D. Lack of sleep. The answer is A. Caffeine. While caffeine may be a migraine trigger for certain individuals, in the majority of people who experience migraine headaches, Caffeine provides significant relief of pain. This may be due to its antagonizing adenosine receptors, which has the effect of cerebral vasoconstriction. Caffeine withdrawal, however, is a common cause of headaches and may trigger migraine in susceptible individuals. Other common migraine triggers include food allergies, medications, bright lights, stress, lack of sleep, hormone fluctuations, strong odors, alcohol, and certain types of exercise. Which of the following seizure types is characterized by a brief loss in muscle control, often resulting in a fall or collapse, in the absence of spasm or rigidity? A. Myoclonic seizure. B. Tonic-clonic seizure. C. Absence seizure. D. Atonic seizure. The answer is D. Atonic seizure. Atonic seizures are characterized by brief, 2 to 15 second, loss or lapses in muscle control, resulting in sudden relaxation of the neck, legs, or whole body. This seizure type frequently causes injury due to falls or head trauma. There may be spasm or twitching at some point during an atonic seizure, but they generally present without any form of rigidity or clonus, unlike tonic-clonic and myoclonic seizures. Atonic seizures differ from absence seizures in that an individual experiencing absence seizures will generally only experience a loss of consciousness, without an accompanying loss of muscle control. Which of the following symptoms describes a typical aura experienced during a complex partial seizure? A. Visual disturbances such as sparks, color fluctuations, or blurry vision. B. Olfactory disturbances, unusual smells, smelling things that are not present. C. A sense of déjà vu or feeling that everything is strangely unfamiliar, jamais vu. D. Odd taste in the mouth. E. All of these are correct. The answer is E. All of these are correct. The aura experienced before a seizure, while frequently thought of as a primarily visual experience, can include disturbances in taste or smell, bodily sensations such as stomachache or tingling, anxiety, or a sense that everything is oddly familiar, déjà vu, or unfamiliar, jamais vu. Which of the following describes a generalized seizure? A. A seizure that involves a specific area limited to one hemisphere of the brain in which there is no loss of consciousness. B. 30 minutes or more of uninterrupted seizure activity. C. A seizure that involves a specific area limited to one hemisphere of the brain in which there is loss or impairment of consciousness. D. A seizure that involves both sides of the brain simultaneously from onset and results in loss of consciousness. The answer is D. A seizure that involves both sides of the brain simultaneously from onset and results in loss of consciousness. A generalized seizure is one which involves both sides of the brain simultaneously from onset and results in loss of consciousness. This is contrasted with complex and simple partial seizures, in which only one area of the brain is involved and the individual may or may not lose consciousness, in complex and simple partial seizures, respectively. Seizure activity that lasts for 30 or more minutes is a rare and serious condition known as status epilepticus. Any seizure that lasts for over 5 minutes is considered a medical emergency and requires emergency assistance. Which of the following is not a type of seizure? A. Myoclonic. B. Absence. C. Simple partial. D. All of these are seizure types. The answer is D. All of these are seizure types. Currently there are over 40 distinct types of seizures recognized by the medical community. Some of the most common seizure types are generalized tonic-clonic, absence, myoclonic, clonic, tonic, febrile, and atonic. Some other less common types include refractory seizures, gelastic seizures, and acrostic seizures. A 7-year-old girl is having issues in school due to lack of attention. Her teacher states that she will space out frequently for a period of 10 to 20 seconds. During these times she will stare straight ahead and will not respond to questions, even if she is called on directly. She does not have any tics or facial movements during these episodes, other than a slight fluttering of the eyelids. Her teacher states she does this several times during the school day, and that it is impacting her performance in school because she is unable to remember what the teacher was talking about during the spell. This child is most likely experiencing which of the following types of seizures? A. Atonic. B. Absence. C. Myoclonic. D. Clonic. The answer is B. Absence. Absence seizures are typified by a brief, 2 to 30-second loss of consciousness in the absence of other symptoms. Individuals with this condition generally will not experience muscle rigidity, as in a tonic seizure, or jerking, as in clonic or myoclonic seizures, nor do they experience a loss of muscle tone, as seen in atonic seizures. Absence seizures present frequently in young children as staring spells and may cause issues with learning or appear as inattentive behavior in school until correctly diagnosed by a medical professional. A 7-year-old girl is having issues in school due to lack of attention. Her teacher states that she will space out frequently for a period of 10 to 20 seconds. During these times she will stare straight ahead and will not respond to questions, even if she is called on directly. She does not have any tics or facial movements during these episodes, other than a slight fluttering of the eyelids. Her teacher states she does this several times during the school day, and that it is impacting her performance in school because she is unable to remember what the teacher was talking about during the spell. Which of the following diagnostic tool would help this child's provider identify her spells as absence seizures? A. CNS ultrasound. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT. D. Electroencephalography, EEG. The answer is D. Electroencephalography, EEG. While CT and MRI may aid in discovering structural abnormalities associated with certain seizure disorders, the correct tool for diagnosis of seizures is electroencephalography, EEG. An EEG can show abnormal surges in brain activity responsible for temporary loss of consciousness in absence seizures. A 3-year-old patient presents for a seizure that occurred at home. To her father's knowledge, she has never had a seizure in the past. She was not ill at the time of the seizure, and she is not on any type of medication. There was no head trauma before the incident. Her father states that her older brother was diagnosed with epilepsy at age 7, and that his grandmother was also epileptic. Is it safe to assume that this child is also epileptic? A. No. Epilepsy is not hereditary, and must present with a history of at least 2 seizure episodes before diagnosis. B. Yes, epilepsy is defined as seizures in the absence of fever, head trauma, or medication. C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. D. Yes, she has a positive family history for epilepsy, and has had a seizure with no clear provocation. The answer is C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. While epilepsy may certainly be hereditary, the diagnosis of epilepsy requires the occurrence of at least 2 seizures during 2 separate incidents, regardless of positive family history. These must occur in the absence of provocative factors such as fever, head trauma, or medication. Which of the following is not a form of generalized seizure? A. Tonic-clonic. B. Complex partial. C. Myoclonic. D. Atonic. The answer is B. Complex partial. Generalized seizures are defined as seizures in which both hemispheres of the brain are affected by seizure activity from the onset. There are 4 main types of generalized seizures: tonic-clonic, myoclonic, atonic, and absence. All of these result in loss of consciousness and may or may not cause spasm or clonus. Complex partial seizures, while also resulting in a loss of consciousness, are restricted to one hemisphere of the brain. What is the most common type of seizure in adults? A. Myoclonic. B. Nonpoleptic. C. Simple partial. D. Tonic-clonic. The answer is D. Tonic-clonic. The most common type of seizure in adults is the tonic-clonic seizure, also known as grand mal. These seizures have 2 stages: a tonic stage, characterized by muscle stiffening and rigidity, followed by a clonic phase, characterized by jerking and twitching of the muscles and the face. Some individuals may have a tendency to have more tonic symptoms or more clonic symptoms, or may go in a tonic-clonic-tonic pattern of alternating rigidity and jerking motions. Individuals in a tonic-clonic seizure experience loss of consciousness and may experience headache, lethargy, confusion, or may want to go to sleep on recovery of consciousness. Which of the following is a term for total absence of sense of smell? A. Hyposmia. B. Dysosmia. C. Anosmia. D. Hyposmia. The answer is C. Anosmia. A total loss or absence of sense of smell is called anosmia. It may be caused by a wide variety of medical conditions, including trauma to the head, stroke, nasal blockage, various dementias, viral infection, toxic exposure, autoimmune disease, or zinc deficiency. Hyposmia is a state in which sense of smell is reduced but not absent, while hyposmia is an increased sensitivity to smell. Dysosmia is an alteration in the perception of smell which may include olfactory hallucinations or distortions. Which of the following is a condition of reduced sensitivity to taste? A. Ageusia. B. Parageusia. C. Dysgeusia. D. Hypogeusia. The answer is D. Hypogeusia. Hypogeusia is a condition of reduced sensitivity to taste. This may be due to various causes, including brain injury, viral infection, zinc deficiency, certain medications such as chemotherapeutic agents or antibiotics. Dysgeusia and parageusia both describe alterations in the perception of taste. These conditions can have similar etiologies to hypogeusia. Ageusia is the total absence of taste perception. Sally arrives at the clinical office for a routine prenatal appointment. She becomes red in the face as she states that lately she has been craving and ingesting dirt. Which of the following is the most appropriate response from the nurse? A. You must be admitted to the hospital. B. Do you have a history of psychiatric illness? C. You must stop immediately. D. Where have you been obtaining the dirt that you're ingesting? E. Why would you eat dirt? The answer is D. Where have you been obtaining the dirt that you're ingesting? During pregnancy, many women crave and eat substances that adults do not generally ingest. This condition is normal and is called pica. Often, the substances do not have high nutritional value. Examples are dirt, chalk, rocks, toothpaste, toilet paper, etc. It is important to determine the risks involved with ingesting these materials. For example, the nurse must determine that a woman who is eating dirt does not ingest potting soil mixed with fertilizer and other potentially toxic chemicals. Your patient is under 24-hour fetal monitoring and observation. The fetal monitoring strip begins to show decelerations, starting after the peak of contractions and recovering late. Which of the following interventions does the nurse anticipate doing? A. Administering medication. B. Reposition mother. C. Fluid bolus with normal saline, NS. D. Removing oxygen supplementation. E. Increasing rate of oxytocin. The answer is B. Reposition mother. Late decelerations are caused by uteroplacental insufficiency. The nurse should anticipate many interventions to promote uteroplacental blood flow. Initially, the nurse should implement oxygen supplementation, stop the oxytocin infusion, reposition the mother to the left side, and introduce a fluid bolus of lactated Ringer's solution, LR. The nurse is reviewing a fetal monitoring strip. Decelerations are onset with the beginning of each contraction and recover at the end of each contraction. Which type of deceleration is this, and why does it occur? A. Variable decelerations, umbilical cord compression. B. Late decelerations, uteroplacental insufficiency. C. Early decelerations, head compression. D. Variable decelerations, head compression. E. Early decelerations, uteroplacental insufficiency. The answer is C. Early decelerations, head compression. A fetal heart rate, FHR, deceleration occurs when the FHR drops 15 bpm below baseline for a period of 15 seconds when the gestation is more than 32 weeks and 10 bpm below baseline for 10 seconds when gestation is less than 32 weeks. When the onset of the deceleration occurs at the onset of a new contraction and recovers with the end of the same contraction, the strip is demonstrating early decelerations, and the fetus is exhibiting head compression. Late decelerations occur when the deceleration begins after the start of a contraction and does not resolve until after the contraction has finished. Late decelerations are the result of uteroplacental insufficiency. A variable deceleration is caused by cord compression, and appears as a brief drop in FHR from baseline then resolves quickly, creating a V shape on the strip. Which of the following describes a Category 2 fetal heart rate, FHR, tracing? A. Baseline 100 bpm, absent variability, 1 acceleration, prolonged decelerations. B. Baseline FHR 170 bpm, moderate variability, 2 accelerations, 0 decelerations. C. Baseline FHR 100 bpm, minimal variability, 0 accelerations, variable decelerations. D. Baseline FHR 145 bpm, moderate variability, 2 accelerations, 0 decelerations. E. Baseline FHR 90 bpm, marked variability, 0 accelerations, late decelerations. The answer is C. Baseline FHR 100 bpm, minimal variability, 0 accelerations, variable decelerations. A Category 2 fetal heart rate tracing include all FHR tracings that are not Category I or Category 3. Category 1 FHR tracings are as follows: baseline 110 to 160 bpm, moderate variability, absent late or variable decelerations, present or absent early decelerations, and present or absent accelerations. Category 3 FHR tracings are as follows: absent baseline FHR variability, recurrent late decelerations, recurrent variable decelerations, bradycardia, and sinusoidal patterns. Which of the following is not a risk factor for gestational diabetes? A. Obesity. B. Poor diet. C. Previous stillbirth. D. Previous macrosomic infant. E. Family history of diabetes. The answer is B. Poor diet. Risk factors for gestational diabetes include obesity, family history of diabetes, history of gestational diabetes, hypertension, preeclampsia/eclampsia, recurrent urinary tract infections, vaginitis, polyhydramnios, previous large infants, 9 pounds or greater than 4,000 grams, glycosuria or proteinuria on 2 or more occasions. While poor diet may contribute to diabetic concerns, it is not directly associated with a higher risk of gestation diabetes as the other risk factors are. During the prenatal period, nurses are responsible for educating their patients on all of these risk factors as well as a proper prenatal diet. The nurse is observing the fetal monitoring strip of a 37-week-old fetus. He observes a visually apparent and abrupt increase in fetal heart rate, FHR, from a baseline of 140 to a peak of 159. The FHR returns to baseline after 20 seconds. What type of fetal heart rate characteristic has occurred? A. Deceleration. B. Recurrent acceleration. C. Prolonged acceleration. D. Acceleration. E. Tachycardia. The answer is D. Acceleration. An acceleration in fetal heart rate is defined as a visually apparent and abrupt increase in FHR, where the FHR increases from the onset of the acceleration to the peak in less than 30 seconds. At less than 32 weeks, the acceleration must peak at least 10 bpm above baseline and last at least 10 seconds. At more than 32 weeks, the acceleration must peak at least 15 bpm above baseline and last at least 15 seconds. A prolonged acceleration follows the same guidelines as an acceleration, but lasts more than 2 minutes and is not longer than 10 minutes in duration. After 10 minutes, it is a change in baseline FHR. A deceleration is a visually apparent decrease in FHR from the baseline, gradual or abrupt, that returns to the original baseline. Recurrent accelerations occur with more than 50% of contracts in any 20-minute window. Tachycardia is a baseline FHR of more than 160 bpm. The nurse observes an electronic fetal monitoring strip. Upon review, the fetal heart rate, FHR, undulates from 140 bpm to 160 bpm and back down to 140 bpm in a consistent cycle over a period of 35 minutes. What type of fetal heart rate characteristic is occurring on this electronic fetal monitoring strip? A. Intermittent. B. Variable. C. Bradycardia. D. Recurrent. E. Sinusoidal. The answer is E. Sinusoidal. A sinusoidal pattern is a visually apparent, smooth, sine wave-like undulating pattern in fetal heart rate baseline with a cycle frequency of at least 3 to 5 minutes that persists for more than 20 minutes. Variable describes an abrupt deceleration of visually apparent decrease and return in fetal heart rate, FHR, from baseline lasting less than 30 seconds. Bradycardia occurs when the baseline FHR is less than 110 bpm. Intermittent describes an acceleration or deceleration occurring with less than 50% of contractions in any 20-minute window. Recurrent describes an acceleration or deceleration occurring with more than 50% of contractions in any 20-minute window. In a fetus positioned at left occiput anterior, LOA, where should the nurse assess the fetal heart rate, FHR? A. Above umbilicus on mother's right side. B. Below umbilicus on mother's right side. C. Above umbilicus on mother's left side. D. Below umbilicus on mother's left side. E. At level of umbilicus. The answer is D. Below umbilicus on mother's left side. When considering where to hear fetal heart rate best, the nurse must consider the location of the fetal back. Weeks gestation or size may also affect the location of the best place to assess fetal heart rate. LOA, or left occiput anterior, is the most common fetal lie. A fetus in LOA is in vertex presentation with the fetal occiput on the mother's left side toward the front of her pelvis. In LOA, the FHR is best heard below the umbilicus on the mother's left side. In LOP, left occiput posterior, the FHR is best heard on the mother's left side at the level of the umbilicus. In ROA, right occiput anterior, the mother's right side below the umbilicus. In ROP, right occiput posterior, the mother's right side at the level of the umbilicus. In LSA, left sacrum anterior, the mother's left side above the umbilicus. In RSA, right sacrum anterior, the mother's right side above the umbilicus. What is the triad of presenting symptoms with endometriosis? A. Dysmenorrhea, infertility, and dyspareunia. B. Dysmenorrhea, menorrhagia, and dysuria. C. Hirsutism, infertility, and oligomenorrhea. D. Menorrhagia, infertility, and dyspareunia. The answer is A. Dysmenorrhea, infertility, and dyspareunia. The triad of presenting symptoms for endometriosis is dysmenorrhea, painful menses, infertility, and dyspareunia, pain on sexual intercourse. The most common presenting symptom is extreme, intense uterine cramps which may radiate to the back or down the thighs. Endometriosis is also a common cause of infertility due to a local paracrine effect. Pain on intercourse may be due to the implantation of endometrial cells in the vagina or the area around the cervix. Endometriosis will not necessarily result in menorrhagia, or excessively heavy bleeding. Hirsutism, infertility, and oligomenorrhea are symptoms commonly seen in polycystic ovarian syndrome, PCOS, rather than endometriosis. Which of the following increase the risk of endometriosis? A. Lack of exercise. B. Presence of an intrauterine device, IUD. C. Family history of endometriosis. D. All of these are correct. The answer is D. All of these are correct. The incidence of endometriosis increases significantly in individuals with a family history of the condition. Other contributing factors are sedentary lifestyle, lack of exercise, presence of an intrauterine device, a diet high in fat, the presence of estrogen dominance, and liver dysfunction, due to decreased estrogen metabolism. Which of the following is a possible cause of vaginal bleeding in early pregnancy? A. Trophoblastic disease. B. Spontaneous abortion, miscarriage. C. cervical ectropion. D. All of these are correct. The answer is D. All of these are correct. All of these could be possible reasons for bleeding in early pregnancy, including physiologic or implantation bleeding. Bleeding may indicate threatened miscarriage or other serious condition, or it may simply be due to the implantation of the embryo into the endometrium. Which of the following terms denotes a menstrual cycle that is irregular, of shorter duration than normal, and of excessive volume or duration? A. Amenorrhea. B. Metrorrhagia. C. Menometrorrhagia. D. Oligomenorrhea. The answer is C. Menometrorrhagia. Menometrorrhagia is a term used to describe a menstrual cycle that is irregular, of shorter duration than normal, and of excessive volume or duration. Amenorrhea is the absence of a menstrual cycle. Metrorrhagia is a term for a menstrual cycle that is of normal flow duration and volume, but which is irregular and has a shorter than normal cycle length. Oligomenorrhea describes a menstrual cycle that is longer than 35 days, often characterized by a prolonged follicular phase. Pregnant individuals with gestational hypertension, proteinuria, and signs of liver or kidney dysfunction should be evaluated for what potentially life-threatening condition? A. Gestational diabetes. B. Placenta previa. C. Ectopic pregnancy. D. Preeclampsia. The answer is D. Preeclampsia. Preeclampsia is a potentially life-threatening disorder that generally includes gestational hypertension, proteinuria, edema, red blood cell dysfunction, and signs of liver or kidney dysfunction. It is more common in weeks 32 to 40 and develops in 2 to 8% of pregnancies worldwide. At what point does preeclampsia develop into eclampsia? A. At the initiation of kidney failure. B. At the progression into seizures. C. When there is evidence of vascular dysregulation. D. When blood pressure exceeds 160/95 mm of mercury. The answer is B. At the progression into seizures. Preeclampsia develops into eclampsia at the onset of seizures. Seizures are tonic-clonic and may appear during pregnancy, during labor, or postpartum. It is relatively rare, affecting only approximately 1.2 to 1.8% of pregnancies. What is the most common time for miscarriages to occur? A. 0 to 12 weeks. B. 12 to 20 weeks. C. 16 to 24 weeks. D. 22 to 28 weeks. The answer is A. 0 to 12 weeks. The most common time for miscarriage to occur is during the first trimester, between 8 and 12 weeks. This may even occur before an individual is aware that they are pregnant. Chromosomal abnormalities are identified in approximately 50% of first trimester miscarriages, while later miscarriages may be more likely in individuals with uterine malformations or cervical incompetence. Which of the following is a risk for preeclampsia? A. Diabetes. B. History of hypertension. C. Bromigravida. D. All of these. The answer is D. All of these. There are several risk factors for preeclampsia. These include history of hypertension, diabetes, older maternal age, first-time pregnancies, primigravida, and pregnancies with twins or multiples. A labor and delivery nurse is assessing a newborn infant and notes that the infant appears to be jaundiced. What is a possible cause for this condition? A. The baby has been born HIV positive, as the mother was unable to afford HIV medications. B. The mother's blood is Rh negative and gave birth to her second Rh positive child without receiving ROGAM during the pregnancy. C. The infant is experiencing fetal alcohol syndrome, as the mother admitted to utilizing drugs and alcohol throughout the pregnancy. D. The mother had gestational diabetes causing jaundice of the infant. E. The mother has exposed the infant to an active genital herpes outbreak. The answer is B. The mother's blood is Rh negative and gave birth to her second Rh positive child without receiving ROGAM during the pregnancy. Jaundice of a newborn may be either pathologic or physiologic. Pathologic jaundice is usually the result of Rh incompatibility between the mother and the fetus. It occurs during a subsequent birth after the mother's blood has been exposed to the infant's blood during the first birth. ROGAM is given to the mother to prevent her immune system from attacking the second fetus, causing erythroblastosis fetalis and subsequent pathological jaundice. A labor and delivery nurse is monitoring a client in active labor after receiving epidural anesthetic. Upon assessing the client, she notes that the patient's blood pressure has fallen to 95/75 millimeters of mercury. The nurse's first action should be A. Obtain an ECG. B. Give 1 mg epinephrine. C. Contact the physician immediately. D. Increase IV fluids. E. Place in semi-Fowler's position. The answer is D. Increase IV fluids. The first action should be to increase fluids, place on their left side and give oxygen. It is not necessary to contact the physician until all nursing interventions have failed. Epinephrine, a vasopressor, should be reserved for emergent situations only. A 26-year-old female primigravida presents to the clinic to discuss her estimated date of birth, EDB. The nurse records the client's first day of her last menstrual period as February 28, 2015. What would be her EDB? A. December 6, 2015. B. December 5, 2015. C. November 5, 2015. D. December 7, 2015. E. November 28, 2015. The answer is B. December 5, 2015. The calculation of an estimated date of birth requires applying Nclex rule, where one's determining the first day of the client's last menstrual period, subtract 3 months and add 7 days and 1 year. The labor and delivery nurse is caring for a pregnant client that is experiencing contractions and has been on an external tokadynamometer to measure fetal heart tones as well as uterine contractions. The nurse notes that there are decreases in the fetal heart rate at different times of a contraction. The nurse is aware that this type of finding is consistent with variable decelerations, which are indicative of which of the following: an uteroplacental insufficiency. B. The effects of decreased pitocin infusion. C. A prolapsed umbilical cord or knuckle cord. D. The third stage of labor. E. Fetal head compression during contraction. The answer is C. A prolapsed umbilical cord or knuckle cord. Variable decelerations can occur at any time during a contraction, or without a contraction. They are caused by the umbilical cord that is prolapsed or wrapped around the fetal neck, also known as a knuckle cord. The compression of the cord can ultimately lead to fetal hypoxia, and therefore an intervention will be required to alleviate the compression. A 24-year-old primigravida client has just given birth to a Rh-positive child and she herself is Rh-negative. The nurse recognizes this situation can lead to future problems in terms of future pregnancies due to this blood type mismatch. All of the following are associated with Rh factor incompatibility except A. May lead to fetal anemia and lead to an acceleration of red blood cell production if the mother is not given Rho. D. Immune globulin to prevent antibodies from destroying fetal blood cells. B. The mother will form IgG and IgM antibodies in response to being exposed to a fetus incompatible blood type. C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. D. The mixing of fetal blood with maternal blood may occur during an amniocentesis or early separation of placenta during birth. E. Kernicterus is a potentially serious effect due to pathological jaundice that can have long-lasting neurological effects on the child if not prevented. The answer is C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. Blood clots are not a common effect in the fetus due to Rh incompatibility. A disorder known as erythroblastosis fetalis is a type of hemolytic disease that occurs in the fetus due to an immune reaction of the Rh-negative mother in an Rh-positive fetus. All other choices are associated with this type of incompatibility. Which type of abortion is associated with sepsis, cramping, abdominal tenderness and an open cervical loss? A. Threatened abortion. B. Spontaneous abortion. C. Inevitable abortion. D. Complete abortion. E. Missed abortion. The answer is E. Missed abortion. A missed abortion is marked by the death of the fetus in utero but is not expelled from the uterus. If left untreated, can lead to infection in the womb. It is marked by foul odor and bleeding as well as an elevated temperature and sepsis. Which of the following statements is true about a high-data-deformed molar pregnancy? A. A molar pregnancy is a type of ectopic pregnancy in need of dilation and curettage to prevent internal hemorrhaging or possible hysterectomy. B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. C. The cause of a molar pregnancy is due multiple ovum becoming fertilized and coalescing to form a cluster of atypical cells containing a haploid number of chromosomes. D. A molar pregnancy can proceed without incident once Rho-D immune globulin is administered to the E. A high-data-deformed molar pregnancy is reported to cause malignancy in approximately 60% of cases. The answer is B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. A high-data-deformed molar pregnancy is mostly a benign process that may occur due to an abnormal ovum becoming fertilized and growing into collection of cells in a cluster-like formation. They are benign over 80% of the time. Rhod immune globulin is a medication administered to an Rh-negative mother that will give birth to a second Rh-positive child to prevent an immune reaction that may harm the child. A woman is hospitalized for preeclampsia. Which medication may the nurse administer to prevent the occurrence of seizures? A. Calcium gluconate. B. Zolpidem. C. Pitocin. D. Nubane. E. Magnesium sulfate. The answer is E. Magnesium sulfate. Magnesium sulfate is used to prevent seizures in women with severe preeclampsia. Calcium gluconate is the antidote if magnesium toxicity is assessed. It should be readily available when a woman is receiving magnesium sulfate. Pitocin is used to stimulate the uterus, often to induce labor. Nubane is an opioid that can be given to women during labor to treat pain. Zolpidem, Ambien, is a sleep aid. Jean is a 33-year-old woman who has previously had regular periods but has not gotten her period for 6 months. Which of the following would the nurse rule out as the cause? A. Cross-country running 5 times per week. B. Poor eating habits. C. Yoga once per week. D. Kidney disease. E. Antidepressant use. The answer is C. Yoga once per week. Yoga once per week, light exercise, is the least likely of the above to cause a change in regular menstruation. Cross-country or long-distance running, vigorous exercise, is more likely to cause changes to a woman's cycle. Poor lifestyle choices such as eating habits and health issues such as kidney disease can also cause irregular menstruation. Likewise, pharmaceuticals can have the same effect. Sandy is 29 years old and experiences bleeding between periods. The nurse marks which of the following on Sandy's medical chart? A. Metorrhagia. B. Menorrhagia. C. Menomtorrhagia. D. Polymenorrhea. E. Oligomenorrhea. The answer is A. Metorrhagia. Metorrhagia is bleeding between periods. Menorrhagia refers to excessively heavy periods. Oligomenorrhea refers to light, scattered periods, typically spaced by greater than 35 days. Polymenorrhea is used to describe short cycles of equal to or less than 21 days. Menomtorrhagia is used to describe periods that are heavier, sporadic, and more frequent than normal periods. A patient tells the nurse that she is practicing fertility awareness. The nurse tells the patient that the unsafe period can range from A. 2 days before and 1 day after ovulation. B. 7 days before and 7 days after ovulation. C. 2 days before and 2 days after ovulation. D. 1 day before and 1 day after ovulation. E. 1 day before and 2 days after ovulation. The answer is B. 7 days before and 7 days after ovulation. According to the family planning method of contraception, the period in which conception can occur and one should refrain from intercourse is up to 7 days before and 7 days after ovulation. Some references show that sperm can live for up to 5 to 7 days inside the female reproductive system. An unfertilized egg can live from between 12 to 24 hours. This greatly increases the window in which conception can occur. Which of the following is false regarding oral contraceptives? A. They may reduce the risk of uterine cancer. B. They may heighten the risk of depression. C. They may decrease the risk of breast cancer. D. They may increase the risk of developing a blood clot. E. They may decrease the severity of menstrual cramps. The answer is C. They may decrease the risk of breast cancer. Oral contraceptives may increase the risk of breast cancer, increase the risk of depression, and increase the risk of developing a blood clot, higher in women who smoke cigarettes. They can reduce the risk of uterine cancer and are frequently used in women with primary dysmenorrhea. Primary dysmenorrhea refers to painful menstrual cycles without an underlying cause. A 51-year-old female arrives at her doctor's office because she has not had any periods for 12 months. The nurse should suspect A. Pelvic inflammatory disease. B. Endometriosis. C. Menopause. D. Polycystic ovarian syndrome. E. Pregnancy. The answer is C. Menopause. Amenorrhea is the complete absence of a period. There are many different causes for amenorrhea. One of the most frequent causes of amenorrhea for women in the fifth decade of life is menopause. Menopause is the most likely cause of amenorrhea in this particular patient because she has not been experiencing periods for 12 months and is 51 years old. While pregnancy is possible, the nurse would suspect menopause first. Pelvic inflammatory disease, PID, is a pelvic infection usually resulting in severe pain. Endometriosis is a condition in which uterine tissue inappropriately grows in areas such as the rectum or ovary, also typically causing severe pain. Polycystic ovarian syndrome is a condition causing hormone imbalance. It can cause amenorrhea. Jody is a 40-year-old woman seeking care for dysmenorrhea for the first time. Which would not be considered an appropriate treatment? A. Oxycodone, acetaminophen. B. Naproxen. C. Oral contraceptives. D. Ibuprofen. E. Lifestyle modifications. The answer is A. Oxycodone, acetaminophen. There are many different ways to treat painful periods, dysmenorrhea. Ibuprofen and naproxen are anti-inflammatory agents that do not require a prescription and can be very effective. They have relatively few side effects. Lifestyle modification, such as exercise, is another good alternative. The use of oral contraceptives are also frequently used to give women lighter and milder periods. Percocet is not generally used because it is an opioid analgesic and not recommended for long-term use because they carry potential for addiction. Which of the following is false regarding the respiratory system of pregnant women? A. There is increased metabolic demand for oxygen from the body. B. The rib cage becomes slightly more compact. C. Total lung capacity decreases. D. Oxygen consumption is increased. E. The diaphragm elevates. The answer is B. The rib cage becomes slightly more compact. In pregnancy, the ribs start to flare, expand slightly, as the pressure from the growing fetus moves the diaphragm upwards. Many women experience this during the third trimester as the baby is at its largest. The flaring of the ribs is assisted by maternal hormones that enable more flexibility throughout the body. Which of the following reasons does not indicate the need to induce labor? A. Post-maturity. B. Diabetes. C. Fetal jeopardy. D. Fetal macrosomia. E. Gestational hypertension. The answer is D. Fetal macrosomia. Induction of labor may occur for various indications: diabetes, post-maturity, hypertensive disorders or pregnancy, fetal jeopardy, or logistical factors including distance from qualified hospital or a rate of rapid birth. Induction of labor may only occur if the mother does not have cephalopelvic disproportion, CPD, the fetus has a vertex presentation with an engaged head, and the mother has a ripened cervix or is prepared to be ripened. Fetal macrosomia is a concerning condition and may require intervention, but is typically not resolved by inducing labor. With fetal macrosomia, a cesarean section may be considered instead of vaginal delivery, due to the potential risks of delivering a large infant vaginally. What is the most common form of female reproductive tumor? A. Choriocarcinoma. B. Uterine leiomyoma. C. Yolk sac tumor. D. Endometrial adenocarcinoma. The answer is B. Uterine leiomyoma. The most common tumor of the female reproductive tract by far is uterine leiomyoma, also known as a uterine fibroid. Uterine fibroids are benign smooth muscle tumors that grow into the myometrium. They can often cause pain in the lower back or pain during penetration, dysmenorrhea, and menorrhagia. Sudden onset of severe abdominal pain with a unilateral adnexal mass would most likely be which of the following conditions? A. Polycystic ovarian syndrome. B. Teratoma. C. Pelvic inflammatory disease. D. Ovarian torsion. The answer is D. Ovarian torsion. While any of the conditions listed can cause abdominal or pelvic pain, the most likely cause of severe pain of sudden onset is ovarian torsion. This is an emergency condition which can result in loss of the affected ovary if not treated within 4 hours. Clear cell adenocarcinoma of the vagina is strongly linked to pre-birth exposure to what medication? A. Acetaminophen. B. Diethylstilbestrol, DES. C. Clomiphene. D. Thalidomide. The answer is B. Diethylstilbestrol, DES. Diethylstilbestrol, a medication used from 1940 to 1971 to reduce the risk of miscarriage, resulted in the later development of clear cell adenocarcinoma in many of the unborn children of these pregnancies. A patient enters the labor and delivery unit. She is having a singleton birth and the baby is showing minimal variability on the fetal monitor. Interventions may include all but A. Giving the patient a 500 ml IV fluid bolus. B. Placing the patient flat on her back. C. Contacting the provider. D. Placing the patient on a non-rebreather mask. E. Suggesting that the patient walk with a portable monitor. The answer is B. Placing the patient flat on her back. Increasing fluid and oxygen administration may increase the overall oxygenation of the fetus and result in greater variability in heart rate. It is advisable to change the position of the patient, however, a supine position is not compatible with pregnancy. Contacting the provider is an acceptable intervention given concern for fetal well-being. What is the most common cause of mucopurulent cervicitis? A. Chlamydia trachomatis. B. Nclex gonorrhea. C. Herpes simplex virus. D. Human papillomavirus. The answer is A. Chlamydia trachomatis. The most common cause of mucopurulent cervicitis is chlamydia trachomatis, followed by Neisseria gonorrhea. Human papillomavirus, while it is associated with increased risk of development of cervical cancer, does not cause mucopurulent cervicitis, nor does herpes simplex. Which of the following conditions can result in temporary masculinization of a pregnant woman which resolves after delivery? A. Placental aromatase deficiency. B. Growth hormone deficiency. C. Closma. D. Polycystic ovarian syndrome. The answer is A. Placental aromatase deficiency. Placental aromatase deficiency is a condition that prevents testosterone from being aromatized into estrogen during pregnancy. This results in a temporary masculinization of the mother that does not continue past delivery. Neither closma nor growth hormone deficiency result in masculinization, and masculinizing symptoms of polycystic ovarian syndrome often improve during pregnancy, rather than getting worse. Which of the following conditions presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy? A. Bacterial vaginosis. B. Lichen sclerosus. C. Contact vulvitis. D. Herpes simplex. The answer is B. Lichen sclerosus. Lichen sclerosus is a condition that presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy. It is most common in postmenopausal women, though it does occur on occasion in younger women and girls. While all of the other conditions listed can cause pruritus and pain, none of them are associated with frank atrophy. All of the following are part of the EMSL criteria for bacterial vaginosis except A. Thin gray or white vaginal discharge. B. Vaginal pH greater than 4.5. C. A positive whiff test on addition of potassium hydroxide to the vaginal discharge. D. All of these are part of the EMSL criteria for bacterial vaginosis. The answer is D. All of these are part of the EMSL criteria for bacterial vaginosis. The EMSL criteria for bacterial vaginosis are as follows: clue cells seen on microscopic examination, a positive whiff test on addition of potassium hydroxide to the vaginal discharge, a vaginal pH greater than 4.5, and thin gray or white vaginal discharge. Which of the following is not a risk factor for uterine leiomyoma? A. Smoking. B. Red meat consumption. C. Obesity. D. Family history. The answer is A. Smoking. The main risk factors for uterine leiomyoma are family history, obesity, and red meat consumption. Smoking is not a risk factor. Up to 90% of cases of pelvic inflammatory disease have what etiology? A. Human papillomavirus only. B. Neisseria gonorrhea E only. C. Neisseria gonorrhea E and chlamydia trachomatis. D. Chlamydia trachomatis only. The answer is C. Neisseria gonorrhea E and chlamydia trachomatis. 75 to 90% of cases of pelvic inflammatory disease are caused by Neisseria gonorrhea E and or chlamydia trachomatis infections. This condition, typified by adhesion formation in the uterus and fallopian tubes, can result in serious issues such as infertility, ectopic pregnancy, or reproductive cancer. Which of the following is part of the diagnostic criteria for pelvic inflammatory disease, PID? A. Fever. B. Leukocytosis. C. Elevated erythrocyte sedimentation rate, ESR. D. All of these. The answer is D. All of these. The criteria for diagnosis of PID are as follows: fever, cervical motion tenderness, abdominal pain, leukocytosis, elevated ESR, and purulent cervical discharge. What would be the primary concern in the case of rubella infection during pregnancy? A. Maternal ocular damage. B. Gestational diabetes. C. Birth defects. D. Maternal death. The answer is C. Birth defects. The primary risk in rubella infection during pregnancy is to the fetus. The rubella virus is able to cross the placenta, and acts as a teratogen by inducing apoptosis in fetal cells. This is termed congenital rubella syndrome. Birth defects can include deafness, ocular damage, cataracts, congenital heart defects, hepatomegaly, and developmental disability or delays. At what time during gestation is a fetus most susceptible to congenital rubella syndrome? A. The first 12 weeks after conception. B. Week 12 to 20. C. Week 20-30. D. Week 30 to 40. The answer is A. The first 12 weeks after conception. Infants who are exposed to rubella during weeks 0-12 of gestation have a 51% chance of developing congenital rubella syndrome. If the fetus is exposed to the virus between 12 and 26 weeks, the incidence of defects drops to 23%. Congenital rubella syndrome is rare in infants whose mothers were initially exposed to the virus after 26 weeks of gestation. Interestingly, the fetus is more likely to have birth defects if the mother contracted rubella before conception. Infants whose mothers contracted the virus 0 to 4 weeks before conception have as much as 43% incidence of congenital rubella syndrome, due to its long incubation period. Which of the following is the definition of gestational hypertension? A. Blood pressure over 160/95 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. C. Blood pressure over 130/85 mm of mercury or rise of more than 35 mm of mercury systolic or 20 mm of mercury diastolic over baseline. D. Blood pressure over 140/90 mm of mercury or rise of more than 40 mm of mercury systolic or 25 mm of mercury diastolic over baseline. The answer is B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. Gestational hypertension is defined as a blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. It generally develops after week 20 of pregnancy and returns to normal after delivery. Which of the following is not a part of the triad of gestational hypertension? A. Proteinuria. B. High blood pressure. C. Edema. D. Headache. The answer is D. Headache. The classic triad of gestational hypertension is high blood pressure, proteinuria, and edema. New onset headaches during a pregnancy that includes gestational hypertension may be a sign of a more severe condition, such as preeclampsia. At what point in a pregnancy is preeclampsia most likely to develop? A. 0 to 12 weeks. B. 12 to 24 weeks. C. 20 to 32 weeks. D. After 32 weeks. The answer is D. After 32 weeks. Preeclampsia occurs more frequently in the last 8 weeks of pregnancy. Occurrence at an earlier gestational age is associated with increased severity and poorer outcomes for both mother and fetus. Which of the following increases risk of ectopic pregnancy? A. History of pelvic inflammatory disease. B. Endometriosis. C. Post-tubal ligation. D. All of these are correct. The answer is D. All of these are correct. Ectopic pregnancy is a serious condition in which an embryo implants in tissue outside the uterus. Risk factors include pelvic inflammatory disease, tubal ligation, endometriosis, tobacco smoking, history of infertility, and the use of assisted reproductive technology. Which of the following is a risk factor for development of toxoplasmosis in pregnancy? A. Undercooked meat. B. Contaminated water. C. Exposure to cat feces, often via a litter box. D. All of these. The answer is D. All of these. Toxoplasmosis is a parasitic infection that is capable of crossing the placenta. It can cause birth defects such as hearing loss, learning disorders, and visual impairment. Toxoplasmosis infection is primarily a concern only in individuals who have never been exposed to the parasite before pregnancy, as most people develop immunity to infection 6 to 9 months after their first exposure, often through contact with cat feces in litter boxes or soil. The main routes of toxoplasmosis infection in pregnant women are exposure to cat feces, water contamination, consumption of undercooked meats, and blood transfusion.